Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about ankle sprains. So before we can start with ankle sprains, we need to start with the normal anatomy. So if you remember, you've got the tibia and the fibula, and they're actually sitting right next to each other. We'll go to the outside of that ankle, and you've got three ligaments. You've got the anterior talofibular ligament. Let me switch here. Anterior talofibular ligament right there. You got the calcaneal fibular ligament and the posterior talofibular ligament. These are the three ligaments of the ankle. On the outside of the ankle, on the inside of the ankle, you've got a huge ligament called the deltoid ligament. It just covers the whole area there. So it's a lot harder to sprain the inside of the ankle than the outside of the ankle. So that's the normal anatomy. As we go from there, there's different types of sprains, right? You can get a lateral ankle sprain where you sprain the lateral ligaments. You can get a medial ankle sprain. Normal, you should have normal anatomy on both the medial side and the lateral side. If you invert your ankle, kind of roll your ankle to the outside where the foot's rolled in and you kind of land on the outside of the ankle, then you end up spraining those lateral ligaments. That's the most common ankle sprain that you'll do. If you roll them to the inside, you'll get the medial ankle sprain. That's not quite as common, but it does happen. And then the other thing that can happen is if you sprain your ligaments enough, so if you roll in enough, if you invert enough, you can actually sprain up the ligaments on the inside of the ankle, between the fibula and tibia as well. This is called the high ankle sprain. This also happens. This can be an issue, and so that's something you need to think about as well. What we're going to focus on today is the main ankle sprain that we see on a regular basis, which is the lateral ankle sprain. So let me move to another picture here. Again, this is a little bit better picture of the ligaments, anterior talofibular, calcaneofibular, and posterior talofibular. When you sprain an ankle, as you roll your ankle in, as you can see they're doing right here, you're going to sprain them in this order. You will actually do here. We'll actually switch here because we can actually make this a little bit easier. You're going to sprain it 1 here, 2 here, and then 3. And so you're going to sprain in that order, and you're kind of going around the horn. So sprains here and then goes around, 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 around. So if you have pain in all 3 ligaments, you got a more severe ankle sprain. And then when it comes to those ankle sprains as well, you can actually have different stages where you just strain the ligament, or you can go as far as tearing it like you're seeing here, where you tore all 3 ligaments. It's called a type 3 ankle sprain. It's more severe, more pain, longer recovery, that kind of stuff. So that's an ankle sprain. And then the question is, what can you do? What should you do for an ankle sprain? You say, okay, I rolled my ankle, it's hurting like crazy. What are the things that we should do? So let's move to the next slide here, and I'm going to actually write this out for you because it's going to make it a little bit easier. So to simplify this process, we're going to actually say, okay, the acronym is RICE. And the whole idea here is to make it so that you can actually get this again, sorry. Looks like we're not. So you get the RICE. And basically what that stands for is rest, ice, compression, elevation. So here you've got the rest. And I'm touching the screen too many times. Let's try again here. Rest, ice. I apologize, the writing wise. So rest, ice, compression, elevation. So I'm going to walk you through those a little bit. So rest, what are the things you can do? You're going to want to limit activities. The best way to rest is to be down, not using it. Some of the other ways you can actually rest it, though, is by bracing it or putting in a boot or something that limits the motion. As you limit that motion, you're resting that ankle. Ice, of course, works really well, especially right after an injury. It's going to decrease swelling, decrease pain, and that actually alleviates. Compression, best way to do this is wrap it in some way. You can wrap it with an ACE wrap. You can wrap it with an ankle brace. Both of those will actually alleviate the pressure and the pain in that area. And elevation is really talking about above the heart. So anytime it's hanging down, it's going to swell, it's going to throb, and you'll actually sometimes even feel it pumping. If you're on it all day, when you go to bed at night, it's going to hurt more, even though you're laying down, just because it's swelling throughout that day. So rest, ice, compression, elevation. The other things that you can actually do for this, there are quite a few. There's a type of laser that can be used for this. It's called MLS laser. It's actually designed to alleviate the pain by decreasing swelling and basically stopping the pain symptoms. But it can also improve the overall healing because it speeds up the healing. So what we commonly will do with MLS laser, you can actually do it 2 to 3 times a week, and we can actually reduce the recovery time from the 4 to 6 week common period to 2 weeks. So we can get athletes back in 2 weeks utilizing the MLS laser. I recommend if you're pushing for that and you're trying to get that done, that you do it at least 3 times a week. So you're going to do it every other day, Monday, Wednesday, Friday type thing, to get you back to normal as quick as possible. It decreases pain, decreases swelling, and stimulates healing. It heals right at the cellular level to cause it to work. The other problem with an ankle sprain is you got an ankle instability because of that, those torn ligaments where they're not working. The problem with ligaments is they don't heal. It's not like you bring them back together and they heal well. Typically, they're going to heal stretched out. They tear, stretch out, they heal in that position with scar tissue. And with the scar tissue in this area, your ankle is going to be a lot less stable. So you're going to step and you'll sprain your ankle a lot easier the second time, fourth time, 10th time than you do the first. So an ankle brace is a good idea if you've got an idea where you're chronically spraining your ankle. An ankle brace will help. An ankle brace, however, does not stop a sprain completely. You can still sprain your ankle in an ankle brace. It's just harder. So what would I do if I had a chronic ankle sprains? I would wear an ankle brace initially. If you get to the point where you're saying, okay, I'm rolling it too often, then you need to talk about an unstable ankle, and we will talk about that tomorrow. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 359, ankle sprains and what you should do for it. Remember, the main idea of what you're going to do for this is going to be rest, ice, compression, elevation. There are other things you can do, MLS laser, anti-inflammatories, but the big thing is to remember to rice your ankle, rest, ice, compression, elevation, to allow it to recover. And by doing that, you can get back to normal activities. This is Dr. Brandt Gibson. Have a great rest of your day. If you have any other questions or you'd like to reach out to us for additional help, you can reach out to us at utahfootdoc.com, and we can give you, no matter where you are in the world, options for your ankle sprain and how you can get it better.